Let's go to the United Kingdom now, where analysts are expected to confirm that the Omicron variant leads to less severe illness than previous strains. The health department there has decided to cut self-isolation days from 10 to 7 days. To get an update on these new developments, our correspondent Olly Barratt speaks to me from London. Thank you, Olly. Now, reports suggest that the UK analysts will confirm that Omicron is leading to less severe illnesses in Britain than previous strains. But what are they saying about hospitalizations?
Well, that is the real key issue that we are looking out for over the next few days. We expect that the UK Health Security Agency will indeed put out its report on those issues before the end of the week, probably. And Cabinet Ministers are very much waiting for it before deciding exactly what to do next. But it is understood that that report will suggest that the severity of the Omicron variant, as was reported in South Africa, is proving to be lower than previous variants here in the UK as well. That would be very good news if indeed confirmed clearly, but one of the caveats to that is that the transmissibility of Omicron, again as reported in South Africa, is very, very high indeed. And so what we expect the UK Health Security Agency to say is that yes, severity is lower, but we may well see a huge spike in hospitalizations all in one go because you just have so many cases happening at once because of the transmissibility of the variant. And that will be the key factors on which cabinet ministers make decisions about exactly what happens next, because yesterday Boris Johnson told the people of England that they can go ahead with their Christmas plans, that there are going to be no new restrictions imposed before Christmas. Whether he imposes restrictions, stricter lockdown measures of some sort or another after Christmas very much depends on this report coming from the UK HSA, we expect before the end of the week, but also on other data that we're seeing as well. And in the last half hour we have seen new numbers from the UK, 106,122 COVID-19 cases reported in the last 24-hour period. That is a record throughout the entire pandemic so far, although we should give the caveat that testing in the UK is much higher than it was right at the start of the pandemic, around 1.5 million tests a day being done at the moment.
Tell me about the measures that are being put in place by Scotland as well as Wales.
Well, this is what's really interesting, is that the Scottish and Welsh administrations get exactly the same data that the London government gets, but they've decided to move now and announce that there will be stricter measures after Christmas. So, for example, in Scotland, the traditional New Year's Eve celebrations, mass events are being called off. Restrictions on gatherings indoors and outdoors. Spectators are effectively being banned from things like football stadiums in the weeks after December the 26th. We're seeing similar in Wales as well. The rule of 6 will be coming back for hospitality, so only 6 people at one table can go into a pub or a restaurant. It'll be table service only. Wales is also banning spectators at things like football matches. So that puts the London government's decision-making process even more firmly in the focus. If Boris Johnson, the Prime Minister, doesn't move and put stricter restrictions in England in place, and the outbreak here spirals out of control and does lead to huge hospitalizations and perhaps fatalities, he will be in for severe criticism. But the opposite is also true. If England doesn't put stricter measures in place and actually the outbreak continues to be not as bad as we've seen from previous variants, then you will expect to see those administrations in Wales and Scotland asked exactly why they acted potentially too soon and too harshly. It's a very difficult balance for all of these governments to try and strike.
Now, Olly, England cutting isolation time for people who've tested positive to COVID from 10 to 7 days. Can you tell us what's motivating this decision?
Well, the UK government would say that this is very much led by the science. The Health Secretary Sajid Javid says that you get as much benefit from this type of isolation period, according to his scientific advice, as you do from going the full 10 days. The idea being that if after 6 days and then 7 days you can provide a negative lateral flow test, then you are free to go. And Sajid Javid says that that is not only based in good science, that will be safe for the population, But it will also free up people to, for example, enjoy Christmas with their families if they're in isolation at the moment, but crucially also get people back into the labour market and back to work. One of the other key concerns about hospitalisations spiking as a result of Omicron is that if they do so rapidly at a time when many doctors and nurses and NHS staff are off sick with COVID-19, with Omicron, then that means you actually have fewer staff to deal with a greater number of sick patients. So that's one of the key considerations here too.
All right, let's leave it there. Thank you very much. Our UK correspondent, Olly Barratt.